So we are going to get started. My name is Alan Morris. My pronouns are he, they. I am the Director of Policy here at the task force. As we get started, tonight's overview or briefing is going to be about affordability. I think this is a very critical conversation at this moment. We're seeing rising gas prices, homes, groceries, all the things, while we're also seeing budgets being cut, federally, which is also going to have a state impact. So we are excited to be joined by one of our fabulous speakers who will be here to really kind of give us the breakdown of things that we're seeing, but also what's to come, right? A lot of the things that have happened over the last year under the current administration definitely is something where we've seen rapid things happen, but also it's a slow and steady, progress up to what is, forthcoming with more cuts. So we are excited to be joined by Christina, who is a amazing advocate and movement lawyer, and she's going to break some of these things down for us and really give us the key insight. I'm going to share my screen here just so we can see just a few slides. It's not going to be as many slides this time, but definitely want to ensure that we can go through and kind of have some things for our visual learners like myself. All right. So again, welcome to Policy Power Hour, the August 2026 edition, brought to you by the Task Force Policy Team, Mira, and myself. Tonight's agenda. Unfortunately, one of our guests is unable to join us, but that's okay because greatness is still with us, right? We have the amazing Christina here, who is one of our guests. So we're going to discuss affordability. And then we'll have a section for Q&A because I'm sure when you see the data, when you see all of the insight, things may pop up, right? And things may come forth, and we want people to feel comfortable to be able to answer those questions and know that they can come here and feel planted. So I'm going to do a brief overview of the amazing Christina, who is a social justice advocate and attorney with expertise in health equity, HIV policy, racial equity, and LGBTQ rights. Most recently, she served as a senior policy manager for health equity for public affairs at AIDS United, where she led health equity initiatives, racial equity efforts, and advocacy capacity building programs for communities disproportionately impacted by HIV. She has also served as a coalition organizer at Equality North Carolina, supporting LGBTQ equality and justice across North Carolina. So welcome, Christina, and we can't wait to hear from you. And this is the amazing Tyrone. Unfortunately, again, they're not going to be with us tonight, but we're sending all our love and care to them. Now, let's jump right in. Tonight, when we talk about affordability and we talk about what we're seeing, one of the main pieces of information that we want people to walk away from is the Big Beautiful Bill, right? Which is also referred as the Big Ugly Act, right? This bill was signed into law on July 4th, 2025, right? And for many of us, we consider this bill an act of cruelty, right? It's something that's going to impact LGBTQ people significantly, but really is going to impact everyone, right? Especially those living with our aging adults, folks with healthcare issues. We are really going to see high stakes as this bill really comes, into form, right? And what we've already seen is some of the cuts have already happened, but there are more cuts that will be scheduled, following through to 2027 and 2028. Now, the act as a whole, when we talk about the big, ugly bill, this bill enforces stricter work reporting requirements and time limits for SNAP and Medicaid, creating more paperwork and making benefits harder to access, even for people who remain eligible, right? So I want you to think about folks that are a caregiver, someone that is, aging, right? Someone that probably saved all their life to have a pension, but now, with different changes in the economy and rising prices, they may not be able to fully depend on those things. So when you think about, adults, age from 55 to 64, we will see a significant number of folks needing to rely on these federal government, programs. We'll also see that Medicaid will require adults age 19 to 64, right, to work or volunteer 80 hours per month. I want people to think about folks who are disabled, right? And, folks who may not necessarily have the access to, get around, whether that be public transportation, actually, having a car. It's many levels to how people who seek out Medicaid, they will be impacted by this. The Big Beautiful Bill will also impose higher costs for states to administer the SNAP and Medicaid program, which will likely force cuts to local programs and possible tax increase. In this moment, y'all, we don't need any more tax increases. We don't need to pay for anything more, right? And so what we're seeing is the more the federal government takes away the support that goes to actual, states, we're going to see a rising cost on the back end, right? Meanwhile, 170 billion is being allocated to immigration enforcement. So I want you all to think about, Alan, you're saying that SNAP, Medicaid, housing, all of these critical programs that people rely on, that's being cut. But yet there was an investment in enforcement, right? Especially for more unjustified detentions and deportations, right? So that's one critical thing. Also, tax credits. A lot of people rely on tax credits coming out of many different things. And so a lot of the tax credits have ended or they're slated to end later on down the line. Now, this is a bigger picture with a more simple approach. And as I read this, please, if something comes up for you or you're like, well, what about this? What about that? Please drop your questions in the chat. My colleague Mira is here. We're going to field those questions, and Christina and I are going out, or we'll try our best to answer the questions as best we can. So, what's at stake? Bigger picture. Up to 11 million people could lose food assistance. Up to 15 million people could lose health coverage. More money would go to immigration enforcement. The wealthy would receive tax cuts. States may have to cut schools, housing, and other services. States may need to raise taxes, right? States could reduce public benefits. Some states might end SNAP programs overall. Over 1.8 million LGBTQ people could lose Medicare coverage, and the work invested to end the HIV epidemic in the US could be weakened. So vulnerable communities will face harm. I know we have could here, but will face harm, right? I know this is a lot of information. There's a lot of, okay, so what is it that I can do? Is it too late? No. And Christina is here to give us that very clear insight. It's not too late. Yes, things were signed into law. Yes, some of your members of Congress and, senators probably stood on the wrong side of history, but we have an opportunity to repeal or delay some of these cuts and defend the programs that our communities rely on, right? So it's about how can we ensure that our members hear our voices and understand what those impacts are going to look like, right? But also the affordability crisis is not new for LGBTQ people. It's rooted in a long history of systemic discrimination, family and social rejection, and broader economic conditions that have left our communities among the hardest hit by these decades of attacks, right? This act is going to compound many of those issues. I want to go back to this number right here. $170 billion is being allocated to immigration enforcement, expanding ICE, and likely driving more unjustified detentions and deportation. And I want this number to stick out to you because when you reach out to your member and you say, what the hell are you doing? Why is 170 billion going here, but yet we cut programs to ensure people can live? This is where it becomes personal, and this is where people have chosen party over people, right? And this is where I want to bring in the amazing Christina, who is going to answer just just a few questions, right? But first, Christina, I would love to, hear from you. Tell us exactly how did we get here?
Hmm. Okay, that seems like a loaded question, but TLDR, right? Prior to last year was passed, but before this year, at the start of the most recent administration, we saw attacks on specific communities through the executive orders that were happening. And it was very soon after Inauguration Day, and folks were very scared. There were a lot of threats to funding, particularly around HIV, prevention and treatment for folks overseas, but also here domestically. At first, it was just overseas, so it seems like, okay, maybe it's not that big of a deal. I don't think that's accurate because HIV exists everywhere, regardless of your country. But um, it was like a slow drip, but it was pretty clear that LGBTQ people, specifically trans folks, immigrants, any any DEI, any flavor of DEI out there, Black, Latino, um, it didn't matter. We were all under attack. And then we're already living in a time where we've been experiencing bouts of inflation, when it comes to affordability. And um, when we think about the workforce, particularly profit space, grant funding has been shifting, and that's also been impacting um, services provided, the work that's being done. Um, and then there were also some changes made at federal agencies. And changes is doing a lot of heavy lifting, with MAHA, with a lot of, funding cuts to old programs, whole departments being cut. Um, it's been an awful time to be working in public health and science related work in this country right now. So all of these things are compounding to the affordability crisis because there were a lot of layoffs that happened, and that impacts, folks economically. But when it comes to the direct impacts of the bill, two big programs that were impacted were the SNAP program and the Medicaid program. And so with SNAP, which, covers food, we're seeing folks having to go without food, folks having to um, skip meals, um, struggle meals are on the rise. All of that is very much happening, and I'm sure you're seeing a lot of things on social media where folks who are used to getting support all of a sudden are getting a large reduction in those resources, having to make do. Um, but even for folks who do not utilize SNAP for whatever reason, maybe they don't qualify, um, make too much money. I'm sure you've noticed that the food prices are quite high for what we're getting. Um, and so that's also impacted. It's not just SNAP when it comes to providing, government resources and funding to people to get food, also the food industries like supermarkets and other stores that also receive SNAP subsidies. So when they don't do that anymore, or they get a reduced number of state subsidies as a result of these cuts, they're going to have to transfer those costs. And that's already on top of the inflation that's already happened. So even if you utilize SNAP or not, you're feeling the impacts. And if you're going to restaurants, you're probably noticing, prices creeping up there because the ingredients are harder to get. You know, Alan, you mentioned something important too. about the immigration enforcement increasing, how that's been impacting, that's been something that has been resourced instead of SNAP or Medicaid in this case. And, we're also experiencing as a result of these cuts and the immigration rate specifically, that's impacted a lot of areas where food is grown in our country to where a lot of farms are unable to even harvest the food that they're growing. And so there's a lot of food waste happening, which is enraging to think about when you're coupling that with people going hungry and having to skip meals to survive. It's a toxic cycle that's been created on that front. And then also on the health, we've, been, the cost of healthcare is high. Oh, that's been an issue. But then in our country, your level of healthcare very much depends on your in if Medicaid has been expanded and all of that. But even, early on with the premium, the enhanced premium tax credits that were not renewed, that impacted people, particularly folks who were on the marketplace, who, utilize insurance or get their insurance that way or get their coverage that way. A lot of them were receiving subsidies that were, higher than normal post-COVID to ensure that more people can get coverage. And, again, things are already expensive, rent is high, inflation is still existing. And, at that moment, they were like, okay, no, we're not going to renew. And, people's premiums immediately went up. And by people, I mean, of course, people on the marketplace. But even if you had employer sponsored healthcare, maybe if you weren't paying a premium, maybe you are now. If you were, it was going to be higher. Maybe your benefits package wasn't looking as good as it used to because it cost too much. That was all happening, and it was quite sudden. I think that has continued to happen, and people have had to go without healthcare. And that's either because of the cost or because they lost their job and don't, no longer have health care. So like I feel like the cuts, when we say that term, it's happening in all different ways, whether it's individually with people, whether it's cuts to industries, cuts are happening across the board.
Okay, so what I'm hearing is, okay, we're seeing cuts in housing. We're seeing cuts in the private sector with folks that are like, okay, I just need my insurance to hold on, right? But then that fee goes up, right? Something that I've noticed, especially here in the DMV area, is there's a longer line at soup kitchens and churches, right? For folks that actually have a place for people to come and get free food, right? We're seeing longer lines. We're seeing
Hmm.
people asking for more help, but also we're seeing people being very blatant. I need financial assistance because I cannot afford this, right? I mean, you've already dived into one of the first questions, which is like, what are some of those real world impacts, right? And I want to add in a personal story here because I was actually having a conversation with one of my great aunts the other day, who is actually, on federal government housing, right? And she was like, I got a letter basically saying that I need to renew. And she did it like 2 months ago, right? Now, this is someone who worked very hard all her life, right? And, now she's raising three young grandchildren. I lost a cousin at a very, early age, and she just got notified that they're slicing the support that she receives coming out of Texas, right? And so these are some of the real world impacts where it's
Mm.
like she's already disabled, she cannot work, right? She recently suffered a health challenge that really like impacted the way that she can actually show up. And so when we think about those real world impacts, that's something that is near and dear to my heart that I'm actively trying to navigate with her. Okay, question number two. Many of the most significant changes really taking full effect in this moment, right? People are definitely paying attention. Again, hearing from my great aunt, I'm like, oh, okay, I see things are starting to shift now as we go into Q3, Q4 of 2026, but it's really going to land in 2027, right? So, what should people be paying attention to over the next year? And who is more likely to be the most impacted? That's also a loaded question.
Right, right. Okay, when I to the changes not taking into effect, like I mentioned earlier, the enhanced premium tax credits for healthcare. And I anticipate more cuts to come. I would be looking out for um state state budgets. State budgets, I think, will be important monitoring because, with the big ugly bill that happened, that was a federal action. And so now each state is left with having to deal with the consequences. And, currently I'm doing consultant work with the Federation, and I monitor state bills from across the country, both around public health and um, around LGBTQ issues, of course. And I noticed this year that there were polarizing reactions to the big beautiful bill. I was seeing bills that were affirming that decision and cutting things as you would imagine, and which is troubling. And then there were states taking a completely different approach where it was like, oh, we're going to have some gaps to fill. Let's figure out how we're going to fill them. And so there were appropriations allocated that were not allocated previously to help address the cuts that were coming up. There were attempts to enshrine new protections against um, different discrimination around certain healthcare procedures like abortion or gender affirming care. And so it was to see that some states were making the approach, but then it made me think like, oh, okay, like this provides an opportunity to get other states onboard in this fight. And so I think looking at, what happens in the fall, knowing that we have an election this year, that actually still means something and provide some leverage while we still have them. I think that it's important for us to um, ask our state legislative candidates, our city council, even anybody who is on a state and local ballot, what can be done, what are you gonna sharing your story with them, but really applying that pressure, being like, I'm already being cut, SNAP or healthcare, or I'm already unemployed, I'm already disabled. What's the state, county, city gonna do? And at minimum, bring this in mind because, at worst, they may call their federal legislators and be like, oh, hey, like, what's good? I think that in this time, like, yeah, it may seem improbable, but elections are happening at the both at the state level and at the federal level. Like we have a couple of months, who knows what could happen. Um, and I think that if the pressure is applied, something will happen. But I do think the state governments have more flexibility to get the work done. But I think of like states like Texas where they don't have legislative session every year. I think that that's something that may require a special session, which has also happened in response to the big beautiful bill. Um, some states have had to either have a special session or they've they're still in session right now, which is weird because it's like August and there wasn't a break. So folks are having to move in a different way in response to this. And so, that always provides an opportunity. But I would also be continuing to monitor healthcare costs. Um, if premiums continue to go up, that is also another thing to bring up to people. And when you mention who is likely to be most affected, um, of course, it's the people who have been on the chopping block this entire, administration. So LGBTQ people, immigrants, um, communities of color, um, mixed status households. Um, but then I'm also thinking about everybody else, people who have money to go to the grocery store and eat. Things are just still going to be expensive. They're going to continue to rise. Um, and what's kind of weird, ironic about that is we're experiencing a lot of like uh food safety issues in our country, lettuce, now jalapenos, and that is making people sick. And these are the same people who are already experiencing financial challenges. They may be laid off, they may be in between healthcare. It it's not going to discriminate, So like that, fortunately, is what's going on. That's just an example of, oh, whoa, if you think you have it, how much is urgent care going to cost? Because I don't have healthcare insurance. Like, what's the out-of-pocket costs? You're going to have to be thinking about that and navigating that. So there, I feel like, whether you utilize these programs or you're not, you're going to be affected in one way or another. So that's how I'll answer that question.
Thank you. Okay, so what I'm hearing is we need to monitor state budgets. We are definitely looking forward to what's going to happen in November and what it's going to look like on the other side, right? But there's also changes in various programs, within people's state, local ordinances that can actually bring forth a bit of relief, right? Like when I think about someplace like Texas, in Houston had its own separate healthcare system that you can apply for services through them, right? And there was a bond. So I need people to listen. When we say, look at your ballot, there was a bond that was on the ballot in 2017, 2018, one of them, that allocated a certain amount of funding towards the Harris County health system so that it could actually expand that funding, right? And so that way, if Medicaid didn't meet the need, it was there to bridge the gap, right? And so those are the types of policies and things that we have to look out for. And look, if we don't see it, we all together, we can bring it forth to one of our council members and say, hey, I learned that this works in this state. Why don't you try to, replicate that, right? Or this is not going to meet the need in this moment. What are the ways that you're going to show up and bring something forth that can actually meet that need for us? And so I really want to give people hope on the opposite end of this. Like, yes, these are definitely some of the impacts, and this country, these states, they have plenty of money, right? They can sit up here and play this game and act like they're broke, act like they don't know what to do. Oh, we're waiting on federal funding. The same way we're seeing cuts and tax breaks for billionaires and trillion dollar companies. These states have the funding and they can get what they need to ensure people have what they need, right? Now, flowing into the last question, right? And you kind of, touched on this. Like, people may be like, okay, Alan, okay, Christina, we hear you, right? But most effective actions that folks can take right now to influence policymakers, right? And for there to be a documented proof, right? That I'm reaching out to my member and I'm letting them know this is what our community needs in this moment.
You could visit if you want to, particularly in their state offices in DC, people who get paid to talk to, probably spend my energy talking to your local and city and county government officials, elected officials. As I said before, it is an election year, so they're going to be out and about. I think requesting a meeting is one way to go about it. But there may be events that are happening in your local community, particularly like political events like a candidate forum. If your organization can, maybe they can host one. If you invite everybody, it's 501(c)(3) friendly. You can absolutely have an educational event for your community to talk to all the candidates to see where they stand, particularly on affordability, healthcare, how they're going to respond to the cuts, however they're coming. State, 'cause like Alan was saying, there is something that these states can do right now. Um, but I would also think about local coalitions that are working around affordability, healthcare, food insecurity. Um, I think that there can be work that could be done, and there's different kinds of groups too. There are some that are working the advocacy, lobbying, policy reform side of things. But then there are some that are more confrontational. They more have like a more of a direct action approach. Okay.
Well,
So,
Christina, hold
maybe
on, really,
maybe
really
you don't want
quick.
to talk about what else.
When we say the direct action approach, I love that phrase, but also I want people to know that it is okay for you to not only name what you need, but name what you want and demand it from your member, right? Because oftentimes people often go into this shell and we see a individual with power and we're like, oh no, they can't do anything. No, that's their damn job, right? Your job is to show up for us. And if that means that I need to come to you, or if I need to write a letter, right? And like maybe non-confrontational, right? I know plenty of people that are non-confrontational and they'll come to me and be like, Alan, can you handle it? From my point of view, if you don't want to take the direct action approach, you can simply go to Google, find out who your member of Congress is, find out who your state is, and get their address. And you can write them, you can write one letter and make 3, 4 copies of it and send it to each one of your members. And just that way, you're dropping something in the mail to them. And that's documented proof that you reached out to them and you gave them, hey, I want you to hear my story. I may not be able to get to DC, or I may not be able to get to my state capital, or I may not be able to get to, you know, office in my neighborhood, but I'm writing you a letter to let you know here is what my family is dealing with in this moment, right? And I want you to prioritize policies that is going to put the money back into my pocket and not line the pockets of big corporations, right? And that's a very like easy way for folks to get involved without feeling the pressure of calling, emailing, all the things. Just a simple letter can do the trick, I promise you. Okay, I'm gonna pass it back to you, Christina.
Mhm. Yeah, no, no, I love where your energy's at. Like spot on, ditto, for sure. Um, and yeah, there are different approaches that you can take. And so thinking about, what feels safe for you, what feels right for you, I think is important. Um, I totally understand folks feeling traumatized or burnt out working on specific issues, but there are other issues that you may be able to leverage your privilege in. If you maybe with let's say with, you know, ICE ICE raids, there's still work to be done there. Those are still happening. I'm in Miami right now. Still happening. Um and so that's something that, if you are not personally impacted, you could absolutely engage in. Making sure that your local uh, state and county election offices are doing what they're supposed to be doing. That's work that you could be engaging in this year. That's super important. Um, volunteering at your local food bank, thinking about, okay, how if my organization that I work at had to create a food bank all of a sudden because there's no funding, what would it take? How, maybe I can learn the ropes here while also investing in my community. I think for us to be flexible in how we think about how we respond to this work, because in the short term be rough, but back and ask for change. We may be left to our own devices. We may have to take care of our own selves and our community. So, be thinking about ways that you can be investing in your local community and your neighbors. Um, but I do think being able to take advantage of the election year and reach out to these legislators and apply pressure is important. And I also think too a good thing to complement, particularly on the state and local front, is utilizing the media.
Mm,
So I
mm,
think
mhm.
that you know you can think like, okay, right now, if we were to do something today, it's like, okay, back to school. Back to school. We can talk about how affordable or not it is to have kids right now and just send them back to school and all of the costs that go with that. Thinking about the cost of food, thinking about the cost of health care. If you're working at an organization, it's like, oh yeah, I wonder how kids are going to get their physicals to go to school if maybe they're cuts, and so thinking about different media hooks to bring up. This is something that's like underutilized. A lot of times when we think about media gets, people focus on national media, which is not nothing. Um, but when you're thinking about your state and local electeds, they're watching or reading local news, you
Yeah.
know. And when it comes to having access to reporters and all of that, it's a lot easier. They tend to, be at events and stuff. So particularly if you're in a more hostile state, like a red state, and let's say for some reason you may not be able to just like schedule a meeting with your legislator. I'm thinking maybe like an Alabama or like some states are like that where it's like, oh yeah, no, we don't do that. So you have to, think creatively of how you're going to approach them. So maybe, you're gonna go to their church's picnic, you know, maybe you're gonna utilize the media that they're reading and being like, oh wow, like I haven't seen so and so in this town for so long, and I can't afford food. Like, you can obviously be a bit more eloquent than that, but there are ways to get your message across to the people that need to hear them at a time when every press hit, every media hit means more to them than normal. And so, if you have that power to use your voice, utilize it. And so I think that, we have to be creative about how we go about pushing back, but also to not just be resigned in defeat. Utilize any and every opportunity that you have because it's gonna matter. Our survival depends on it, dare I say.
You know what? Thank you for that. I mean, something that I keep thinking about is when, for me, a effective strategy that folks can take in this moment is how do we have a multi-generational approach to community, right? How do we get as many people from across movements, across faith denominations to understand that this moment calls for us to all be together, right? We are stronger in numbers. So that's my recommendation. How can I reach out and find community somewhere that is often unlikely for me, right? How can I find a faith community that is doing the work in the neighborhood? I may not be a believer, but I just see what they're doing and I want to give them some help. I want to volunteer, or I want to pass on the National LGBTQ Task Force website and have them come to Policy Power Hour so they can talk about here's what's happening in our community and how we need help, right? There are various ways that folks can definitely get involved, and it doesn't necessarily have to be a heavy lift, right? Another way that is very critical is there's a lot of misinformation out there, right? Folks often do
Mhm.
not understand what they're hearing and seeing on the TV, coming from the, top person in the White House, right? And so you all are receiving some very critical information in this moment. So how can I take what I learned here and pass it on to someone else, right? Something that I often say is each one, teach one, reach one, right? So anything
Yeah.
that you're learning here, you can pass that on to someone else. And now you've done your job, right? And you've tied some truth and trust in the task force, but also now that someone else can have that truth, they can find a home to come to listen to it, and to gain that knowledge. Something that I, often think about when we say protecting our communities, we keep us safe, right? And the only way we will continue to keep us safe is by our people showing up and doing the work and pushing these, lawmakers to do their job. So as long as you know that you are planted in your fierceness and in everything that you need to do, trust me, things will shift. And again, we have been here before, right? We have been here, we have seen this, and it's not anything that we were not able to overcome, right? I want to tap into Q&A. So if you have questions, please go ahead and drop them in the chat. Since my organization can't lobby, we're doing individual support for protecting democracy actions like targeted approach for untapped communities. Okay, Jordan, thank you. Okay, so y'all look, we have a resource right here for folks that need to do it from a individual point of view, and you may not want to get your, organization involved. Please check out. Okay, Nerds Vote. I love that. Please check out www.nerdsvote.com, and you can do it on your own time. Also, we have the amazing Heidi Ellis in the comments. If for anyone in DC that want to learn more about LGBTQ advocacy, please hit them up. They drop their email in the chat. So I just want to take 5 minutes just to see if anyone has any questions, anything that we can answer. And while we field questions, I want to pull up the CTA just one last time to ensure that people can see it and we have accessibility. Okay. Present. Okay. So, call to action. Tell your members of Congress to repeal the cuts. That's very, very simple. And look, you can Google their number and call them. And as soon as the staffer answers the phone, don't be rude. Say, hey, how are you first? Okay. Everybody say, hey, how are you first? Okay. And then you tell them, tell blah, 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 repeal the cuts from the one big beautiful bill. Click. And then, hey, oh, have a great day. Click. So we want to speak first. They need to do, tell them to have a good day, and then click. Okay. Number 2, call on your state government to apply for implementation delays and support state budget advocacy. This is the most critical because, as Christina has clearly highlighted, the state budget is our last line of defense, right? And they have the tools in their toolbox to do what we need them to do. Do not feel intimidated. They are there to do the work for you. Now, every state is different again. So you may hit a roadblock here or there. You may not get the, answer you want, and that's okay. But always remember, if you don't get the answer you want by picking up the phone, calling, you can always find that address and you can mail them a personal letter. And then last but certainly not least, support a local anti-poverty or mutual aid organization. If you have your cell phone, you can scan this QR code and it will send you to the LGBT. Christina, what's the name of it? Help me out here.
Is it the Anti-Poverty
Yes.
Network?
Yes. So this is the LGBTQ Anti-Poverty Network. Please, you can go to this website. You can sign up to receive notifications and get more involved. All right. I'm going to stop sharing here momentarily. Mira, do we have any questions?
Any in the chat?
But we have two more slides to share. I'm not letting y'all go easy today because we got some action items for y'all. Okay. Okay, let's go back to the slides. Task number one, subscribe to our Substack, y'all. We are doing some amazing things on Substack. We got some amazing content coming down the line. So look, you can pick up your phone. If you have an iPhone, if you it actually it don't matter, whatever type of phone you have, just open up that camera app and you can scan this, and this will bring you directly to our Substack. And guess what? We already got some content there. You can go ahead and you can read something that we recently dropped, right? And there's some more things coming down the pipeline. So please subscribe to our Substack. And then last but certainly not least, we want to thank each and every one of you who took the time to come out. The next Policy Power Hour will be held on October 13th, 2026. Guess what? If you still have that camera up, you can scan this middle QR code and you can go ahead and register tonight for Policy Power Hour being held on October 13th, 2026. The topic will be around the midterms and what to expect coming out on the other side of it. So we just want to thank each of you for coming. If you referred a friend, continue to do so. And please make sure that you follow us at the task force on Instagram and Facebook. Well, thank you all so much for coming. This is where we end. We hope that you all go forth and be great. And if you need anything, the task force is here with our love and support. Have a good night.
Bye, everyone.